You know, we know that having a diagnosis of cancer of any kind just obliges you to take a trip, a journey that you'd never planned on, one that you don't want to go on. You likely don't have any maps, and you know, there's not a lot prior to the event that's going to help you out. But hopefully tonight you're going to get some valuable information. Many of you are already well down the road and able to help others. But hopefully we'll be able to share some information with you tonight that you maybe haven't heard before, or it might help clarify something you've heard many times already. So I'm going to just talk a little bit about what is normal in a coping sense, in what for most people is a very unusual circumstance of dealing with cancer. I actually, I've got a mic on, but you're having difficulty hearing? That's better? Okay. Talk a little bit about what is normal under these very unusual circumstances for most people. What does good coping look like? What might we associate with, you know, how to best help ourselves and help others? And then I'm going to tell you a little bit about patient and family support services. And while I'm doing these slides, you're going to see a couple of pictures that have been done by folks in the art therapy program at Cancer Care. And this is the first one. So this is a collage somebody did about what their experience was like upon being diagnosed. And you can see that there's a real hodgepodge of stuff in there. Lots of things that are unpleasant and lots of confusion and questions. And for most people, it is a very confusing time, with the range of normal in terms of reactions being far wider than we'd probably ever expect until we were in that situation. So feelings, the obvious feelings of fear and anxiety, sometimes anger, sometimes guilt, regret, many things. And also an intensity of emotion that lots of people haven't felt before. An intensity of emotion and also a timing of emotion that we may not have experienced before. So many of you will be familiar with, you know, the roller coaster, the big ups and downs, the tsunami of emotions that can just come over you at any time. All of that is well within a range of normal. So given that there's a pretty broad range of challenging things to cope with, what does good coping look like? What would we tend to know about that? This is an old citation that I've used, but it's actually, there's lots of good information, lots of research that's talked to people, lots about what tends to be associated with people who can manage better than others. Well, the first thing is feeling a degree of personal control. So most of us don't choose for bad things to happen to us, and certainly wouldn't choose or plan on a cancer diagnosis. And once it's happened, you can't really control that piece. But you can control what happens after that. And one of the main things that helps you feel a sense of control is having information, the kind of information you need and you can use. Information helps you feel confident about the decisions you make, and probably your best source of information is going to be your healthcare team. Lots of us go to the internet, and very often I hear a lot of people talking about going to the internet and getting themselves quite frightened and confused, and that it's, you know, at some point they just say, no, you know, just stop. And they revert back to their healthcare team to kind of distill out the information that applies specifically to them so that they can base their choices on good information. I'm not discouraging the research piece, but just trying to normalize that feeling of getting overwhelmed when you first come to try and find some information. The second thing that tends to be associated with good coping is an awareness of your feelings and your abilities. So when you're having this massive array of feelings like that picture referred to, it can be kind of hard to know exactly what you're feeling. You know, are my reactions right now related to anxiety or fear or anger? Or does everything look like anger but it's actually fear? So trying to be aware of your feelings can be a very challenging thing, but trying to clarify them can be useful. You also have skills and abilities and innate capacities that you bring to the experience, that sometimes when you're kind of knocked off your pins by a diagnosis or by the challenges of treatment, you can kind of lose track of them. And it can be very helpful to get back in touch with the strengths and qualities that have led you through many challenging times before your diagnosis. Open communication. That's a really important one, something that doesn't come easy to all of us. Open communication with your healthcare team, with the people around you, being able to ask for what you need. It rolls off my tongue pretty slickly, but it's not easy, I know. And this is one of the things that I'll touch on in a few minutes in terms of the availability of support. Another thing that tends to be associated with good coping is the ability to experience or tolerate feelings related to the illness without persistent anxiety or depression. Being anxious and having a low mood is very normal when you're dealing with diagnosis, treatment, and even the after phase. It's human. It's not going to sabotage the effectiveness of your chemotherapy. It's not going to let anybody down if you have a down day or a short period of time. But if you have symptoms of anxiety or low mood that last for more than 2 weeks and are kind of affecting how you function on a day-to-day basis, that's something worth talking to someone about. Someone like your family doctor, your oncologist, or someone at cancer care. Because you know, it's treatable. There's talk therapy. There's other kinds of therapy that can be used, and sometimes medication. But low mood or severe anxiety that's impacting your function that lasts for more than a couple of weeks is something worth looking into, because it doesn't you don't have to live with that for a prolonged period of time. This is just an example, another example of the work done by the art therapy, someone in art therapy. And this was a woman, and she wrote, "Like a dog with a bone, I can't let go of my fear of dying. My fear eases as I put my feelings on paper." I'm not saying anything that will shock any of you, that many of us, the first thing we associate with the word cancer is death. But there's lots of people in this room who are absolute testimony to that that's not a necessary or automatic equation. But the fear and the anxiety about that is something that lots of people deal with during treatment and certainly in the time after treatment. And this person's experience was that when she actually expressed those feelings and acknowledged them, that they somehow became a little bit more manageable. So as I said, you come to the cancer experience with lots of abilities and experiences from your life up until then. You also come usually with lots of sources of support. You know, social support, the people in your community, the types of activities you've always done that have brought you relaxation and, you know, made you feel good or helped you to de-stress. And the, you know, the family relationships, community relationships, friendships, all those things you bring with you. And it's, as much as you can, it's really important and helpful to maintain some control in your life by being involved with all of those things as you can manage. The other option is patient and family support services. We're hopeful that we can kind of enrich your toolbox of support. This is, you know, different times they do surveys for different things at cancer care, and these were some lines that were drawn out of some surveys that speak directly to people's need for and utilization of support. First comment is something that folks talk a lot about when they come to see us. My emotional recovery was harder than my physical recovery. We know that when the treatment's over, it ain't over, right? There's the whole idea of returning to life, creating a new normal, and looking towards the future and investing in the future. And we've had lots of people say, "I didn't even know you existed." You know, we are kind of around a corner. We try to promote ourselves, but sometimes people don't really realize the types of supports that are available. And the other observation with this is that patient and family support services is a portal to some things that you might find very useful. So I'm just going to quickly, because I know I'm tick-tocking down to my time, Patient and Family Information and Resource Center is a lending library for patients and family members. It's located at the 675 McDermott site, and there's a smaller one over at the St. Boniface site. There are materials directed at the person with the diagnosis, at family members, at children. There are also 2 computers with internet access, and the volunteers can help you to access sites that might be of interest to you. There is a coordinator in that center who knows every book in there by heart, and during the week there's a coordinator there for a good part of the day, and there's always a volunteer to assist. The other thing that's available there is a non-clinic type setting where you can just hang out, if you have time between appointments and you don't want to be in one of the large clinic waiting areas. There's a television, there's always coffee and tea on. Nutrition Services, Cancer Care has 3 dietitians. There's 2 positions, but there's 3 people that fill them. They are available to consult with anybody about nutrition and about any kinds of difficulties they're having in relation to gaining weight or even losing weight, or using the kind of food that might be most helpful for them. Also in terms of kind of sorting through some of the alternative kinds of approaches or complementary approaches with diet. Pharmacists are also very helpful for that, but our dietitians do that kind of work as well. You don't need a doctor's referral to see one of the dietitians. You can just call up Patient and Family Support Services or drop by. The Guardian Angel Caring Room is there's one at the McDermott site, and there's also a smaller one at St. Boniface. And that's a place where you can borrow side effect related head coverings. They also offer information sessions, the Look Good, Feel Better program, and also some other kinds of information centers through there. And that's open at different times during the week, and it's a good idea to book an appointment. Speech-language pathologist is associated with our department, mostly for people who are having difficulty with swallowing or speech. And then the Department of Psychosocial Oncology, which is the part of Patients and Family Support Services that I work with. So we have about 8 social workers, we have a psychologist, we have 2 consulting psychiatrists that we work with and refer to. Most of us spend most of our time meeting with individuals or family members around their stresses associated with having cancer, recovering from cancer, or totally after their treatment experience. We also offer a lot of programs. So there's programs like art therapy, yoga, Pilates. We do a mindfulness-based stress, we've changed the name. It's now called Mindfulness Practice. It's a meditation, an 8-week meditation program. We offer something called Cancer Transitions, which is a 6-week program focusing on nutrition and activity and medical management, managing your own sort of medical follow-up for people who've completed treatment. And brain fog, which is an 8-week program for people who are experiencing cognitive side effects following diagnosis and treatment with cancer. We have a variety of support programs. There's not a specific bladder cancer support group at Cancer Care. There will be a support group for a multi-disease site for any type of cancer starting up in the new year. But there is also for people where there's no specific group at Cancer Care, there are online support groups. There's 2 of us that work with a national organization that does professionally facilitated online support groups across Canada. And if you'd like to know more about that, you can call me or speak to me later. It's something I didn't think would be a great idea, but it works really well. And then we also do work at information sessions like this and do some community teaching. This is a photograph of the Navigator, and there are some up-to-date ones out on the Cancer Care Manitoba table. And this comes out, a new one each month. It lists all of the programs that we offer through Patient and Family Support Services, and it's pretty comprehensive, and it offers all the telephone numbers you would need to access any of them. So that was a real gallop through the information I wanted to share. But clearly, this is a many-faceted experience for all of you. You're going to be meeting tonight with some physicians who are going to share information with you about care and options. And Patient and Family Support Services is very much wanting for you to give us a call if you feel that any of the things that I've been talking about might be helpful. Our hope is that we can, you know, you can't really get out of this, but you can get through it. And there's lots of supports available if that seems like something that would fit. So thank you.